David, Isaac and Melanie Field for coming to give evidence today to talk about the EHRC's views on the unequal impact of coronavirus. I wanted to start by talking about the important role the EHRC could play in this, but we heard from Melanie on, I think it was the 18th of March, that you hadn't been asked to provide any input to government. Have you subsequently been asked for your input? And if not, what advice would you have given?
So, Chair, I'll answer that question if I may. When Melanie first gave advice at your last meeting, it was correct, and it continues to be correct that we haven't had a response to the letter that I wrote to the Prime Minister at the beginning of March, at the beginning of lockdown. Having said that, we have dealt with lots of officials in different departments and with other arm's length bodies. So the answer to your question is that we would welcome more engagement with ministers. We have direct requests out to the Secretary of State, who is also Minister for Women and Equalities, Liz Truss, and I've met with her on a number of occasions in the past. But given the complexity of the issues, we believe that government has an important role which we can assist with. And the sooner we can engage in more detail, particularly in relation to building back better as we ease lockdown. Our view is that the Equality Act, and in particular the public sector equality duty, provides a really important framework. And what we're seeing as part of the COVID pandemic is that some of the underlying inequalities that we identified prior to COVID have become more acute. So we'd like to work with government to address those acute issues, but also plan for the future, and direct engagement with more senior government colleagues would be very helpful. They have a really important role in setting strategy, clearly in relation to legislation, but also their overseeing role in relation to local authorities.
So you've reached out to the Minister for Women and Equalities, but I'm conscious that there are equalities issues across a variety of government departments. I can think immediately, of course, the Home Office, but the Department for Work and Pensions, the Department for Health and Social Care. Have you made any direct contact with the Secretaries of State in those departments?
We have, yes, we have. I mean, we understand everyone is really busy prioritising saving lives, but we haven't actually managed to get meetings. So, for example, in relation to education, we have written to the Secretary of State. We have had various discussions with officials, but haven't managed to engage where either Melanie and I or our Chief Exec can actually meet directly. So if you could assist us so that we could actually move beyond meeting with officials, which, to be clear, has been a very positive experience. We're all rowing in the same direction. But to be involved in some of the strategic resolution of both short-term and long-term issues by engaging with Secretaries of State and Ministers more generally would be very helpful.
And is it your sense through your engagement with officials that there's been buy-in at a political level to the equalities concerns that this committee and indeed other select committees have been investigating?
My reply would be that it is at best patchy. I think, if I'm frank, my concern is that sometimes equality issues do seem to be on the agenda, but not towards the top of it. And this comes back to the point I was making in relation to the need that government has in a crisis situation like this to save lives. We fully understand this, but we believe that in relation to many of the concerns raised by our stakeholders, many of the individuals who approach us, and the cases that people ask us to get involved in, it would be helpful to have a coherent strategy across the whole of government. So in short, I'm in agreement with you. It would be very helpful. And we've asked for that in the past. I think there's agreement in principle, but anything that you could do to assist us to actually have that joined up conversation would be helpful. So to give another example, in relation to issues in relation to race and ethnicity, we've called for a joined up approach towards race strategy across the whole of government. But in terms of the detailed breakdown of that, particularly in the COVID situation, that hasn't sadly happened yet.
What more do you think the EHRC could be doing proactively to make sure that there was a joined up voice across government on this?
I think the answer is a mixture of a carrot and stick. We think that the carrot would actually enable the government to come up with a more robust approach, which would actually address the concerns of many people, particularly in areas that are more directly impacted by the virus, but also by socioeconomic issues more generally, which clearly is a concern for the government and part of its mandate when it was elected last year. But the other part, which is the stick, is that, as I said right at the very start, the Equality Act does actually provide quite a useful framework, and the public sector equality duty in particular is something that we would be really keen for government, for individual departments, but also for local authorities to use as a way forward. So the template exists, and what we don't want to do is to be issuing investigations in relation to why the public sector equality duty wasn't used as much or as effectively as it might be. But actually through dialogue, we'd like to do that much, much more. I've always said that as a muscular regulator, we could and should use our enforcement powers if we have to. But right now, our inclination is to work constructively with government and local authorities to ensure that lives are saved, but also that we do what we are required to do, which is to draw concerns in relation to equality and human rights issues to their attention.
Do you have any concerns that the public sector equality duty and the duty to consider that has become something of a box ticking exercise?
Yes, I think the answer is that we at the Commission would like that to have more teeth. We think it's a framework, as I say, that is effective, but sadly, we don't think that there is either enough engagement or enough understanding, or I guess, fear about the consequences of not using it. So I certainly would like us to be in dialogue more, but also to demonstrate that the public sector equality duty is to be taken seriously and is a powerful tool to deal with the issues that we're all concerned about, not just saving lives, but actually building back better to address these inequality issues that are particularly acute at the moment.
Do you think that simply having more dialogue would show the public sector equality duty having more teeth, or have you put forward to government any specific proposals as to how that duty could have more teeth?
Dialogue, in our experience at a time like this, is a good place to start. And in answer to your question about whether we've put concrete examples forward to individual departments, yes, we have. And we've been doing it in relation to our discussions with partners. So arm's length bodies, for example, in relation to education. Yesterday, I was going to refer to this later, but I had a meeting with the chair of Ofqual in relation to our concerns about some of the potential inequalities arising from predictive grades. And I was able to tell colleagues at Ofqual that the public sector equality duty was a very effective tool to enable them to take those equality considerations into account when they make a decision about how the detail of predictive marking is going to operate, so that people aren't disadvantaged if they come from groups of protected characteristic communities.
Can I just move on to ask you a little bit about the equality impact assessment? We heard from the Secretary of State that she regarded that as an internal document and that she certainly didn't want to publish it when she appeared before the committee and has subsequently continued to hold that position in writing. Why is it important that it should be published? And how can you assist in putting pressure on the government to publish it?
So like you, we've also encouraged the Secretary of State to share that equality impact assessment. It's important because actually, even though the Secretary of State doesn't have a legal obligation to share that with us, they do have a legal obligation to show their workings and that they have discharged the public sector equality duty, and that they've taken the various factors into account to mitigate the adverse consequences of inequality. And so it's a good tool, but most importantly, the reason that it would be helpful to see it is that we can engage more constructively with their approach. There is greater transparency, and dare I say, parliamentarians can then engage alongside us to determine whether or not we are satisfied that all reasonable steps are being taken to drive improved equality as part of the response to COVID.
I think it's really obvious over the course of the last couple of months that we have seen challenges around the unequal impact of COVID that perhaps couldn't have been predicted at the start, but are now certainly very, very apparent. And I would highlight in particular the unequal impact on people from Black, Asian, minority ethnic communities. Do you think that the Equalities Impact Assessment that we've not yet seen is something that is a static, set in time document, or actually something that should be continually evolving? And is there a case for there to be a refresh on it at set periods of time?
So it's a tool. I think it therefore should be organic and it should be reviewed on a regular basis. And I'd like to do two things. One, make sure that in terms of the legal obligations, they were more effective. And I didn't pick this up in relation to my last answer. We do not ideally want to be wasting the time of local authorities, of government, and also resource from the Commission to be bringing enforcement proceedings in relation to a failure to use the public sector equality duty. But it should be dynamic, it can be very effective, and it allows the transparency and discussion and ratcheting up of expectations, which do need to be incremental, we accept that, to address the very concerns that I think your committee and we at the Commission share. So
do you think it should be redone?
Well, I'd like it to be used in its existing form so that more organisations actually take it more seriously. I'm always worried about increased bureaucracy, but actually if we could have more powers so that it was taken more seriously and it had more teeth, then I would welcome that too.
Thank you. Can I now bring in Belle Ribeiro Addy? I think I've got it is Belle next, yes, to ask you some questions. Thank you.
Thank you.
Hello. Hi, David. I just following on from that, I just wanted to ask, do you think that it's right that the government's not made to publish an equality impact assessment, given that it is their duty to produce it? And are there no ways that the EHRC can compel them to do so?
Can I hand over to Melanie in relation to that? Because I know she's just been in touch with me to say she's quite keen to add to something I said earlier on. So if we could talk, if Melanie could talk to that first, and then I can pick up as appropriate later. Melanie.
Thanks, David. Sorry, I did want to just come back to one point of clarification. David earlier said that we hadn't met any ministers in relation to this, and I just wanted to let you know that I actually had a meeting with Victoria Prentice of DEFRA last week about some concerns that we'd raised about disabled people's access to food. So I just wanted to make that clarification. In response to the questions about the public sector equality duty, I think I talked a little bit when I came to the committee last time about our, is there a strange noise? About our proposals to strengthen the public sector equality duty. So we would like to see it being used in a more strategic way. And we have developed proposals and been working with a range of government and non-government stakeholders to develop those proposals. So I just wanted to flag that. I think the importance of the equality impact assessment is that it gives transparency about the possible impacts and enables people, as David said, to engage on what potential mitigations there might be. And I think that links also to the our calls for the 2 monthly reports to Parliament on the use of the emergency legislation. So the first one being due next Monday, I believe. We've been calling for those to include an assessment of how those measures have impacted on different people with different protected characteristics. So it's really about having transparency and enabling there to be constructive challenge and the development of measures to try to mitigate some of the impacts that are emerging over time as we're going through this process.
Just to follow up again, my worry is that if it isn't transparent, as it seems in this case, then all of those other aspects that you've said kind of fall away in terms of what we're able to see and then what we're able to do. So just generally, I've always thought of the EHRC as the police of the Equalities Act. Is there nothing that can be done to compel certain things to come forward? I know obviously you can ask for the 2-month review, but in terms of it being published, is there nothing that can be done?
Shall I just quickly?
Yeah, Melanie, do you want to take that?
Technical point. So the position on the public sector equality duty in England is there is no specific duty in the secondary legislation to support the public sector equality duty. Equality impact assessments to be written or published. That position is different in both Wales and Scotland. And what we have been doing is looking at how the public sector equality duty can be strengthened in a way that doesn't lead to just process, as the chair was saying, kind of tick box approach, but actually meaningful consideration about how public functions can be used to improve equality, not just sort of mitigate against negative impacts, but actually improve the position of groups that have been historically disadvantaged.
Interrupt you a moment, Belle.
Yeah.
And specifically on that point, would there be the possibility of legal action in Scotland and Wales, but not in England, to compel them to publish it? And if so, would the Commission consider that?
So the Scottish and Welsh public sector equality duties apply to Scottish and Welsh public authorities, so they don't apply to UK government.
So you can't, there is no legal avenue you could pursue to oblige them to publish?
So as David explained, what we can do is challenge compliance with the substantive duty. So they do need to be able to show that they would need, if challenged legally, to be able to show that they have had due regard to the 3 limbs of the public sector equality duty. So they would need to produce evidence that they had considered the equality impacts. Publishing an equality impact assessment is a very easy way of doing that. Of course, some equality impact assessments don't actually show that there's been proper consideration, but that would certainly be a start. But it would the failure to publish wouldn't prevent us, if we chose to do that, bringing a challenge in relation to, or doing an assessment to examine the extent to which there was that consideration.
And are you considering that?
We are considering a whole range of issues, yes. So obviously the duty falls on specific departments rather than government as a whole. So we're looking at how we could, where we can get that information to give ourselves assurance that the duty has been complied with.
So if it falls on specific departments, are you considering action against, for example, the Government Equalities Office?
Well, we see the Government Equalities Office as having an important leadership role in terms of ensuring that government as a whole is giving proper consideration to equality issues.
Okay, thank you. Sorry, Belle, back to you.
That's okay. Thanks. So you'll be aware of the Office of National Statistics results that that review that's found that Black people are 4 times more likely to die from COVID-19 than white people, and even after they've taken into account age, health, disability and other socio-demographic characteristics, BAME people are still overall up to 2.5 times more likely to die from a COVID-19 related death. Now, this has kind of led to, and other issues with those with protected characteristics, has led to Public England's review into health outcomes. And I understand from what you said earlier, David, that you haven't been asked directly by the government to be involved in any particular view, but has the EHRC been asked in any way to feed into Public Health England's review into these matters? And what would you want to feed into that review if you haven't been asked?
I'm going to ask Melanie to answer this because we have been asked and Melanie is very actively involved. So Melanie.
Thanks, David. Yes, so we contacted both NHS England and Public Health England when we heard about the review and asked to engage with it and offer our expertise in terms of our understanding of the kind of systemic issues potentially underlying some of these emerging bits of evidence. And also to assist with any stakeholder engagement. I attended the first stakeholder roundtable that Professor Fenton held, and following that we had a separate meeting with the team, feeding in our views, and we have already submitted some comments on the methodology, and this week we will be submitting our own analysis of other pieces of relevant work that are going on, and also some policy recommendations. So our general approach is that we welcome this review, but it is very limited in scope. It's obviously being done very rapidly and it has a very specific focus. And it will not answer all the questions that we believe need to be answered about the multiple factors that could be contributing to the sorts of figures that we are seeing.
Mm-hmm. So on that basis, you would have seen that a lot of prominent people in the BAME community and other MPs have called for a public inquiry. Do you think that's a more appropriate way to deal with these disparities? Obviously, we do need some answers now, but given the amount that you're saying is involved, do you think that would be more appropriate?
I think the precise mechanism, I think, there are various ways that it could be done, but I think what is definitely needed is a comprehensive and joined up approach that looks at all the potential contributing factors and draws together all of the research and anecdotal evidence that's emerging, and seeks to draw some well-founded conclusions which would enable us to develop proper responses that would be effective. So I think there are various ways that could be done. I think the Race Disparity Unit in government has an important role to play here, and we've been seeking to engage with them on that as well. And we've been doing our own mapping of what we know about the research going on and looking to see if there are gaps that can be filled. But I think what is needed is a really comprehensive and joined up approach, and then coming out of that, a really comprehensive and joined up cross-government strategy to actually address the factors that are contributing to these disparities.
And Chair, can I just add to what Melanie has said, please?
Go ahead, David.
Oh, yes. Belle, I was just keen to take the opportunity to say, obviously, we share your real concern and the concern of the BAME community and their allies in relation to the severity of the impact of the virus on the BAME community as well as other communities. And we understand the real anxieties that exist, and building upon what Melanie was saying, we're really keen to play our part. I mean, this is a wake-up moment in relation to the severity of the issues affecting BME communities, and we do need a coherent way forward, which actually COVID presents an opportunity as well as a disaster. The opportunity of COVID now gives us, and we want to play our part along with our partners and with parliamentarians in delivering that.
Thank you. You'll see that the government have taken the time, obviously and rightly so, to shield particular the people with protected characteristics. So we know that people with diabetes are 3.5 times more likely to die from a COVID-19 related death, and they would come under a disability, and so they're being shielded. But with BAME people having being up to 4 times more likely, even when you, and 2.5 times more likely when you remove those their underlying health conditions. Do you think that at this moment in time the government should be looking towards more shielding measures, and putting them on parity with some of the other individuals they're protecting, in particular with the coronavirus?
Thank you. I think the problem is that it's really too early to say what the factors are. We know that comorbidities may be a factor. We know that socio-economic issues and housing conditions may be a factor. We know that the places where BAME people are disproportionately employed may be a factor. So there's a whole range of issues around exposure and susceptibility that we really need to unpack. And I think, there'd be concerns about kind of blanket measures applied that restrict the freedoms of a sector of the community without them being properly evidence-based. So that's why I think we need that better evidence base. I mean, just to say that we published a report back in 2017 called A Roadmap to Race Equality, which was where we called for a joined up race equality strategy. And it's really interesting to see. So that called for action on a number of areas, 5 areas: health, education, employment, housing, and criminal justice. And these are all factors that we think may be contributing to what we're seeing at the moment. So these are long-standing issues that are really being thrown into sharp relief by this current crisis.
But do we think that may be an issue in itself? So we've touched on today, data, getting in the appropriate amount of data, and there seems to be enough kind of evidence, as you're saying, for people with underlying health conditions to warrant that they would need some sort of shielding in this case. Do you think the issue in terms of not looking at certain measures for BAME people might be that a sufficient amount of data hasn't been collected? And if the data had been collected in line with what we expect under equalities provisions, that we may have had a clearer answer by now in terms of what we should do?
I think if we had better data, and certainly we need better data, then we would know more than we know now. I just think we need to be slightly cautious about, and hopefully the Public Health England review will shed some light on this, about the extent to which what we're seeing is due to increased levels of exposure to the virus. So, we are relying on the BAME community to drive our buses, service in supermarkets, and provide our health and care services. They're all these are all areas where ethnic minority communities are overrepresented in the workforce and are facing increased exposure to the virus. Then there are the kind of increased levels of comorbidities that we know about, so diabetes, for example, being one, which mean that people who get the black and minority ethnic people who get the virus may be more susceptible to experiencing it worse, and therefore experiencing higher mortality rates. But I think it would be, I'm not clear that we've yet got the evidence to say that that means that those communities should be subject to greater restrictions than other members of the community.
You touched on members of the BAME community doing certain jobs, and in relation to being more exposed. Do you think that as part of the review we should be looking at what's happened with PPE, protective equipment, in terms of why this may have happened, and if that should factor quite heavily into any review or inquiry?
So as I understand it, and the bit of the review that is being done by NHS England will be looking at the impacts for NHS staff. So hopefully that will shed some light, but certainly there is lots of media coverage and lots of information we're getting from stakeholders about concerns about, first of all, the availability of PPE at all, and then the suitability of PPE, particularly for women. And there have been concerns about, for some ethnic minority staff, whether PPE fits people properly, whether it was designed to fit a range of body shapes and face shapes. Clearly that is an issue. Also, of course, we know about the issues around PPE in care homes, where again, BAME people are working in disproportionate numbers.
And just finally, you pointed to a lack of consistent guidance and absence of a national policy framework about who gets what type of treatment. And would you say that it's possible that the disproportionate deaths from COVID-19, the BAME community, could highlight possible inequalities in treatments when people become critically ill from the virus? And do you think that that the government are doing enough in that regard, in terms of what the Minister for Women and Equality said? And she was quite clear that the government are doing enough to get out the message that there shouldn't be discrimination. But without a policy framework, do you think that it's possible to ensure that there is no discrimination? And if we were to put one in place, who do you think should have oversight of it?
So there is nice guidance on access to treatment. There were some early concerns about that nice guidance. I think this is sort of representative of this whole crisis, that government has had, and other public authorities have had to respond incredibly quickly to unprecedented circumstances. NICE developed some guidance on the assumption that that the NHS could be overwhelmed and that there could be a need to ration access to treatment and equipment. There were some early concerns about that guidance, particularly in relation to how it dealt with disabled people, and whether disabled people with non-pertinent disabilities or long-term conditions might be disadvantaged with that. I'm not aware of any particular issues related to concerns about how that guidance would apply to BME people. Those concerns were addressed quite rapidly by NICE. The BMA also produced the ethical guidance, which again raised similar concerns. We wrote to the BMA about that, and they very quickly amended their guidance and addressed those concerns. So I think, given the fact that the circumstances, didn't come to pass, in that the NHS has in fact coped incredibly well with the pressures that it's been facing and has not been put in the position of having to make those choices, I think we feel at the moment that the guidance that is there is sufficient.
Thank you very much.
Thank you. Can I bring in Kim Johnston now, please?
Thank you, Chair. Hello, David and Melanie. The social care sector, as we know, is very large, it's very diverse, and it's very fragmented and under-resourced in the last 10 years. The government has said that the easing of local authority duties was intended to help local authorities to prioritise those most in need. And from your discussions with stakeholders, what has actually been happening on the ground, particularly within care homes and within care settings within the community, because social care is not just about care homes. Thank you.
So thank you for the question, and I'm going to answer this. And I'll start by saying I completely agree with the point you ended on, which is that social care isn't just about care homes. We've been hugely concerned about the release of people from hospital without testing, and obviously the large number of deaths in care homes. But back to your main question, we have had concerns for some time about the adequacy of social care provision for people with protected characteristics. It really comes back to one of my opening comments, which is that COVID has obviously shone a light on some of the existing inequalities in relation to how people from particular communities are impacted, and in relation to older people and disabled people in particular. We've been looking and doing a lot of work with particularly disabled people's organisations. In answer to your question about what stakeholders are telling us, they're telling us that there's huge anxiety about lack of provision. They're telling us that on the ground, they are seeing that easements have a real impact upon their ability to get support, to get personal assistance, and to contribute in a way in which they would otherwise wish to contribute. We understand why local authorities in particular are constrained, but actually, back to my earlier point about the role of government, the government, we would urge, should ring-fence sufficient funds to allow people who are particularly old and vulnerable, or another category that I'm hugely supportive of working with, children with special educational needs and disabilities. These are communities that are already struggling, and COVID has made their support particularly worsen. So by ring-fencing money and by overseeing the provision and a commitment to that continuation is absolutely vital to protect these people who don't like to be called vulnerable for very important reasons, but actually who are valid recipients of our support and of the money that we as a state contribute to look after everybody.
Thanks, David. But you just mentioned funding. So the government has committed extra funding to local authorities. We've had some criticism from some authorities and that the money hasn't been sufficient. And the last tranche of funding that some authorities received, particularly mine in Liverpool, wasn't enough to meet the needs that we're actually dealing with. So the question is, do you think the money is enough? And is the funding getting where it should be going?
I can't really comment on the adequacy of the funds. You'll understand. Clearly, my desire to protect people with protected characteristics is to ensure that they have adequate provision. And listening to what you're saying, I would go back to my earlier point about making sure that there are adequate funds. We know that local authorities have to make difficult decisions, but these difficult decisions should not be made at the expense of people with disabilities, older people, and children or students with special educational needs and disabilities.
Yeah. David, you just mentioned the easements that have been allowed as a result of the Coronavirus Act. And question is, what kind of information do we need from local authorities to make sure these powers aren't being used in a way that amounts to discrimination? And what do you see as the role of local authorities in scrutinising this?
Well, I would say that easements should only be used if they're absolutely essential. Mm-hmm. I would urge them to use the public sector equality duty approach that we've been talking about in today's meeting to determine whether or not equality considerations are being factored into their thinking, either in relation to the prioritization of funds, but equally in relation to how easements are going to be implemented. We understand that when people are dying, government and local authorities need to try and be as agile as they can to protect lives. But what we're seeing and what we hear from people who talk to us through various organizations who we work in partnership with is that that's actually having a detrimental effect on their day-to-day provision of funding and of support and their ability to live.
Okay, thanks, David. And do you have any idea of the number of local authorities that are using these powers across the country at the moment?
I don't know the total number at the moment, but we know that in the Midlands there were 7 local authorities who were applying for easements or seeking to use easements. Melanie, I don't know whether you have any more up-to-date information than that.
So the briefing that that colleagues have provided, so when they wrote it, it was 7. So it was Derbyshire, Coventry, Birmingham, Solihull, Warwickshire, Staffordshire and Sunderland. Middlesbrough also triggered the easements in April, but has since then withdrawn them.
Okay, and so the question related to that then is, and do you have any idea whether the reducing of those easements has had any significant impact on any particular protected characteristic in any of those local authorities?
I think we don't know currently what's actually happening in those particular local authorities. What we do know is the generic anxiety and reporting of deterioration in support and personal assistant provision that I talked about. Yeah. I mean, one of the final points actually to make in relation to social care is, you know, we do have enforcement powers. I've talked about how we're keen to be in dialogue and to be constructive, but because of the real anxiety, particularly in the SEND community and in the disabled community, this is an area that we'll be looking at very carefully.
Thanks, David. Sorry.
Melanie.
Coming back on the end of that, so I think this kind of goes back to the earlier conversation about transparency, and obviously when the reporting is done on Monday on the use of the emergency legislation, that's exactly the sort of information that we would like to see, so that we can see what the impact of this has been on the ground.
Thanks, Melanie. There has been some criticism from some groups in terms of with underlying health conditions and people being denied treatment and families being asked to sign DNRs. So what you're doing to ensure that these particular people with care needs remain visible during this crisis?
Melanie, do you want to answer that given your involvement with the BMA?
Yes, so we have seen some quite worrying examples of letters that have gone out to people in care homes and people with learning disabilities about how what they might expect in terms of treatment should they contract the virus, and we have been alerted to instances of people being feeling pressured to sign do not attempt resuscitation notices, and people with learning disabilities perhaps being asked to do that without appropriate support. So we have been working very closely with the CQC and referring those concerns to them. and they're the appropriate regulator for that, and they've been taking that very seriously, and I understand are taking action to ensure that that kind of approach doesn't occur. So I think everyone is very clear that it shouldn't be happening.
Thanks, Melanie. But it's also been suggested that unconscious bias has also played a role in terms of the disproportionate Black people being affected by the coronavirus. Do you have an opinion on that?
Melanie, do you want to? I mean, I've got a view, but Melanie, do you want to continue?
Sorry, I'm not sure in what respect.
Well, in terms of, you know, as Black people are not getting equal access to treatment, it's been suggested that this has been a contributory factor in terms of the increasing number of deaths within this particular group.
Well, I would hope that that's something that will be picked up in the Public Health England review. But David, do you want to come in if you wanted to?
Yes, I was going to make a wider point about unconscious bias, because I think in relation to many of the issues that we're hearing about and are seeing in the context of COVID, unconscious bias does actually play a role. So as a Commission, we really appreciate the significance that conscious and unconscious bias actually has in relation to contributing towards unequal treatment. And this is particularly the case in relation to education and the whole area of unconscious bias training and its impact is something I raised with Ofqual yesterday.
Thanks very much, David and Melanie. They're all my questions.
Thank you.
Thank you very much, Kim. Can I just pick up on something David said about he didn't feel able to comment on the adequacy of funding? Is that through a lack of information on your part or some other reason?
A lack of information, because what I was able to comment on was that in relation to social care, there should be adequate provision. What the quantum of that might be, I'm not entirely sure, but my concern to ensure that there is no discrimination is that older, disabled or other groups with protected characteristics should be adequately provided for to live their lives to their full potential.
And when it comes to unconscious bias, does the Commission have any concerns with regard to the development of things like track and tracing apps, where we know that the vast majority of all apps are designed by white men in their early 20s, that there might be any challenge around unconscious bias within those apps?
We do have concerns about that. We talk about those sorts of issues a lot. We talk about how unconscious bias training is important, but actually it's not a universal panacea. Awareness of that kind of bias, I think, is a good starting point, but actually some of our research has demonstrated that it can be counterproductive too. So I think transparency, which is a theme that's coming through this afternoon, is really important. Awareness is really important, and making people understand what those issues are. My biggest concern often is that it shouldn't result in paralysis, and that would be my concern about overplaying unconscious bias in the development of a tracing app. We need that as soon as possible.
Thank you, David. Can I now bring in Alex Davis-Jones, please? Can we unmute Alex?
Yeah. Thank you, Chair, and thank you both Melanie and David for giving evidence to us today. You've told us that the pregnancy and maternity discrimination in the workplace during the pandemic is a major equality concern. What types of discrimination in regards to pregnancy and maternity are you aware of?
And Melanie's going to answer that question, please.
Yeah, so I mean, we've done some quite kind of rapid engagement with stakeholders and gathering information that comes in through the Equality Advisory and Support Service, and also talking to employers just to try to understand what the issues were that really started to arise in the workplace at the beginning of the lockdown. And concerns about pregnant workers and mothers in the workplace were a theme that came through quite strongly. I think through a lack of confusion about employers' obligations and workers' rights in relation to particularly decisions being made about furloughing, decisions being made to put pregnant workers on sick leave rather than furlough, concerns about the inability or inadequacy of health and safety risk assessments for pregnant workers who were then working either in more risky situations or at home. And again, where an employer is unable to redeploy a pregnant worker to somewhere where they're safe to work, then they should be suspended on full pay rather than asked to take sick leave or put on furlough. So there's a kind of clutch of issues around that. I think that some through lack of understanding and unfortunately some potentially just discriminatory decisions.
Yeah, thank you, Melanie. How prevalent are each of these forms of discrimination, and how much have they increased as a result of the pandemic?
Well, we did a piece of work some time ago which suggested that pregnancy discrimination was quite prevalent. I'm just trying to find the relevant figures, but certainly a number of women were made redundant while on maternity leave. So that was a particular issue that came out of that. We did a joint piece of work with the Department for Business and Enterprise, which gave us some information about that. We'd very much like to see that kind of study repeated so that we can get a better understanding of actually what's going on in the current situation.
Thank you. And is there a specific sector that this is more prevalent in than others?
I don't think we have that data, but I mean, there are sectors where younger women tend to work. So, for example, in the hospitality sector, in health and care. So I guess we would expect to see those issues arising more in those sectors. So we don't really have the data at the moment.
Well, that follows on actually to my next question. So are you collecting the data on pregnancy and maternity discrimination during the pandemic, or is it not available?
Well, we are gathering what information is coming in, but short of doing a kind of universal survey, it's difficult to know how we would. So you would need quite a sizable survey to get a real picture. So what we're relying on is the evidence of the issues that are being brought to our attention. We would like to see a broader study, and we think that that's something that government should be doing routinely. Okay.
So what steps are the Equality and Human Rights Commission taking with regards to some of this discrimination? Are you planning, for example, to carry out any enforcement action or supporting any legal cases as a result of this?
So we wrote out to all of our stakeholders and particularly our legal stakeholders and advice agencies, again, at the beginning of the pandemic, seeking information about what was going on and asking them to let us know about relevant cases. So I'm not aware of any that have come in at the moment that we are considering supporting, but in the meantime, we quite rapidly produced some guidance for employers to remind them of their obligation to pregnant workers and new mothers. We issued that quite quickly. We worked in conjunction with a lot of business organisations to get that out. I've got colleagues actually at a meeting with all the British Chambers of Commerce branches this afternoon as part of our dissemination of that guidance. So we've been doing a lot of work with employer organisations, and that guidance was really warmly welcomed by the business sector.
Okay, and do you see there being a bigger risk of more employment discrimination of all kinds as the furlough and the self-employment schemes are all phased out now? What do you think should be done to mitigate this?
So, well, we produced, as I said, that guidance. We also produced some other guidance about making reasonable adjustments for disabled workers and just about general avoiding discriminatory decision making. The fact is that employers are having to make quite difficult decisions. Everybody is having to make difficult decisions at the moment. And as David said earlier, it's important that people have equality considerations really at the front of their mind and think about their obligations. So I think in times of pressure, I think the risk of discrimination, whether intentional or unintentional, is always heightened, and we need to be hyper alert to it. So I think it's part of our role to remind people of that, but it's also part of the government's role to remind people of that. And I think it's really important in terms of the guidance that the government is developing about returning to work. We're concerned that equality considerations haven't really been brought out sufficiently in that. So that's, we've raised that with the department. We've got meetings coming up with officials about that. And that's something where we would really like to see an improved approach.
Okay. So thank you, Melanie. You've warned that pregnant women and those on maternity leave face a greater risk of redundancy in a recession and recommend that the government urgently extend redundancy protections. Are you able to briefly explain how you'd like current protections to be strengthened?
So the government has already committed to extend the redundancy protection already available to pregnant workers to 6 months. So we think, so it's currently 3 months. They've said they will extend it to 6 months. We would like that to happen now.
Right.
We're also concerned about people's ability, where they are discriminated against, to actually bring employment tribunal claims of discrimination during this period. So we are also calling on government to extend the time limit for all types of discrimination claim. So for, pregnancy and maternity discrimination, sexual harassment, but also disability discrimination and race discrimination. We would like the time limit extended to 6 months. At the moment, it's 3 months, which we don't think is really adequate given the difficulties that people will be facing in accessing advice at this time.
And how are you pushing for that to be carried out? For example, do you think it should be legislation for pregnancy and maternity protections?
So I believe there will be a need for a legislative change to the redundancy protection and also to extend the time limit. So there is some guidance, some court guidance, which encourages discretion to be exercised in terms of increasing time limits. But we would like to see that put on a statutory footing. So we'd like the government to be looking for an opportunity in a piece of legislation to insert that provision.
Okay, and you've been pushing the government, but what type of response have you had in terms of their willingness to want to cooperate with you on this?
We haven't had any kind of formal response to that. It was one of the recommendations we included in our evidence to you, which has been published today. And we've also written to the Secretary of State for Business, and we've also written to the Minister for Women and Equalities about it.
And had no response thus far?
Not yet.
Right. Okay. I've heard from a constituent of mine who owns a small business. They had an employee who went on maternity leave in July last year, and then after an annual review during maternity leave was given a pay rise in September last year. Now the company has had to furlough that member of staff. Her pay rise has not been included in the government's furlough calculation, since if the person was not at work in February of this year due to maternity leave, the furlough pay is calculated from February's last year, so before her pay rise. Would you argue that this breaches the Equality Act? Because if it was a male, they would not be financially disadvantaged in this way.
So our general position is that both the furloughing scheme and the support scheme for self-employed people needs to take account of the fact that people go on maternity and parental leave, and that people shouldn't be disadvantaged because of that. I'm not able to say at this moment whether I I think that's a breach of the Equality Act, but it's certainly something that we can look at.
Okay, thank you. And then, are you working with frontline advice services like Maternity Action, Working Families and Pregnant Then Screwed, for example, who have all voiced their concerns quite loudly to the committee and to the media and to anyone who will listen, really, about the volume of calls that they're receiving about pregnancy and maternity discrimination at the moment?
So these are within the stakeholders that we regularly engage with. So we are getting that information coming through to us from them, and obviously agree with many of the positions that they've been pushing.
Okay, thank you, Chair. No more questions from me.
Can I bring in Peter Gibson, please, who wanted to ask a follow-up question on this section?
Yeah, just a small follow-up. Thank you, Chair. Just a small follow-up on the questions that Alex has raised with you. Is it possible for a business to legally and legitimately make a pregnant or woman on maternity leave redundant without it being deemed discriminatory?
I think I would need to come back to you with the help of one of our lawyers to answer that question definitively.
So the implication is that it's automatically discriminatory.
Can I come in? I don't think it is automatically discriminatory, but again, we would have to check.
Because I think there's an issue here in terms of exploring that discrimination, which needs to be rightly checked and balanced and tackled against the fear of an employee being treated for redundancy in an absolutely fair and transparent and open way, just as if they were at work and they were not on maternity leave. And I think there is need for some clarity around that messaging for our business community to know that if they are running a redundancy process, and the likelihood of there being redundancy processes in the months ahead is increasingly likely, that there is clarity for those businesses that they can proceed in the normal course of dealing with the challenges caused by the pandemic and the downturn in their businesses and how they need to address them in a way that they are not fearing challenges in the employment tribunals for discrimination.
Yeah, I take the point. I'm pretty sure that the guidance that we produced covers it, but I'm afraid I haven't got that level of detail at my fingertips, but we can certainly write to you and clarify that point.
It might be something that requires some publicity at this time to bring it to people's attention. Thank you.
Thank you.
Can I just check, going very quickly to say, in our guidance, we are very closely in dialogue with the business community. They are important stakeholders of ours, and that kind of clarity and their ability to continue to run their businesses and balance the ability to run business with protecting equality rights is something that we're very mindful of.
Thank you. Nothing further at this stage. Thank you, Caroline.
Thank you, Peter. Can I just follow something up with Melanie? You referenced returning to work and the government's approach to that. I think you used the phrase it needed an improved approach. Have you given any consideration to express the view on the focus on which industries and sectors of the economy are returning, and the fact that, and everyone believes me to be obsessed with this, but the hair and beauty sector, which employs 83% women in hairdressing and 94% in the beauty industry, looks to be one of the last sectors that is going back, yet construction very early. And I wondered whether you had any concerns about the ease with which women would be able to return to work, given the phasing that is going to have to go on.
I probably share your concern and obsession with the hair and beauty sector. It isn't something that we've it is something that I hope we will have dialogue with the department about in terms of the segmentation of the approach. and the differential impacts of that on different protected characteristic groups. So those discussions are ongoing at the moment, and so we will certainly be looking at that.
Thank you. Can I now bring in Angela Crawley, please?
Welcome to David and Melanie. Can I just briefly cover one point? You'll be aware that there's a judicial review application in place by the Child Poverty Action Group regarding maternity pay. Because understanding is that maternity allowance is treated as unearned income by the Department of Work and Pensions. Could you comment on what the EHRC is doing on this issue, if anything?
Melanie, can I ask you to respond?
I have to confess I wasn't aware of that, but thank you for drawing it to our attention, and I will go away and see what we can find out. Thank you.
Okay, thank you for that. Now coming on to income, some of your key recommendations for protecting people's incomes during the pandemic have been specifically on offering the same financial support to the gig economy workers as furloughed employees, removing lower income thresholds for statutory sick pay and on the furlough scheme, and more than tripling the rate of statutory sick pay to over £300 per week. Now, why do you think these are the best measures to ensure the interests of equality?
Well, Melanie, shall I start off with areas that I feel able to talk about in relation to universal credit and sick pay, because obviously we are very concerned about non-discrimination in those areas, and what we're worried about from an equality point of view is adequacy of income to allow people to continue to live independently, particularly if they are disabled, but equally that even though various easements have been introduced, that the conditionality in relation to some of the provisions means that there are large numbers of people, particularly if they're disabled, who are not eligible or feel deterred from actually applying, particularly for benefits. And you probably know we've seen a reduction in the number of disabled people applying for benefits during the lockdown. So that may be for a variety of reasons. So we would say that equality considerations underpin responses to this whole area in relation to social security. And it comes back to many of the themes that we've been talking about, which is enabling people to receive adequate income if through no fault of their own they are unable to generate income independently.
Okay, thank you, David. Now, specifically, which groups of people with the under-protected characteristics would most benefit from some of the recommendations you've just outlined? And I'm thinking specifically of Black, Asian, minority, ethnic women who are particularly impacted by this pandemic. And could you comment on any specific recommendations you have put forward to protect this group?
Melanie, can I hand over to you in relation to the BME side? Clearly, I flagged our concern about disabled people, and that continues to be a major theme of our work and our stakeholder engagement. But on Black and minority ethnic employment issues, Melanie, can I hand over to you, please?
You're welcome to, but I'm afraid I couldn't really hear the question very well. I'm sorry, you were breaking up a little bit during that. Is it possible for you to just repeat that?
Sure, of course. My question was specifically on what recommendations have been made to protect Black, Asian, minority ethnic women who are particularly impacted by the COVID pandemic.
So I think this sort of relates to the questions earlier from Belle about the extent to which particular protections need to be put in place. So I think we're concerned about the suitability and availability of PPE. We're concerned about the prevalence of Black and minority ethnic workers in public-facing frontline roles and what that means in terms of their exposure. So, you know, there's a whole range of issues there which I think need to be looked at properly and understood properly. I mean, I think what employers need to do is look at an individually based, risk-based approach when thinking about the risks that their workers are being placed at, given those multiple factors that can come together to increase risk.
Okay, thank you, Melanie. Now, David, you mentioned your concerns regarding universal credit. You've told us that your key concern about the benefit system is the 5-week wait between the first universal credit claim and the first payment. Now, you want the government to take all reasonable steps to reduce it, but what do you actually mean by all reasonable steps? And if 5 weeks is too long, but universal credit cannot deliver first payments quicker, is there another different solution that you would consider to be essential that you would recommend?
So it's a killer question, because obviously the law fudges this issue about what those reasonable steps actually are in practice, because sometimes what is reasonable is so subjective that it's very difficult to come up with an objective standard, as you appreciate. My answer really goes back to the whole question of conditionality that I referred to in a second ago, because I think the presumption here should be, and it is particularly the case during COVID, that we need to protect our people. We need to ensure that they have adequate income and provision. And on that basis, what we would hope to do is to set up a social security system that's going to work for everybody, particularly at a time of a pandemic. And so creating thresholds and conditions which actually mean that large numbers of people are ineligible is a real bar to many people who have protected characteristics. So that's the area of our concern.
Thank you, David. Now, would you support changing the emergency advance scheme to an emergency grant, which claimants would not need to pay back if they could show that they needed it to cover essentials? And similarly, would you consider an alternative scheme entirely, as you just outlined, potentially a universal basic income to support those who are most vulnerable and in need in a sustained way?
I know there's a big debate going on about a universal basic income, and as yet we don't have a position on that. Our approach is very much focused on equalities and human rights considerations, which really focuses on the fact that we are concerned that during the pandemic there are many people who don't have any food. The number of people who are going hungry is a major issue. There are fundamental socioeconomic considerations here, and from previous evidence that we've given to this committee that we would like the socioeconomic provisions in Part 1 of the Equality Act to be implemented. They aren't currently, so it's an area that's outside our remit. But we do think that there are very significant concerns here, and that a people-first approach during the pandemic is something that we would really urge government to consider.
Okay, thank you, David. Your responses are really helpful to the committee. Now, Melanie, you appeared for the committee on the 18th of March, and the GEO and EHRC announced the suspension of the gender pay gap reporting deadline and any enforcement of action. Can you talk us through the thinking on that recommendation and why you didn't press to postpone the deadline?
Sorry, could you just repeat the very end of what you said? Why?
Of course. Why you didn't postpone the deadline instead?
So I think obviously I was here, as you say, on the 18th of March. The reporting deadline was at the end of March, and I think I attended the last meeting that you had in reality as opposed to virtually. So everything was just on the verge of shutting down, and the country was in a state of flux, and employers were faced with having to moved very quickly from normal ways of working to very different ways of working. So I think it became apparent to us very quickly that that making employers think they needed to focus on publishing their gender pay gap information at the end of that month was not helpful, and that one thing that we could do to support the country was to make it clear that that requirement was not going to take place. We talked to government about that, and whether a kind of suspending or postponing approach was better, and we came to the joint conclusion that it because we didn't know what was going to happen over the next several months, it could well be that we would be pushing the deadline back to a point when it kind of merged into the next reporting period. So I think the decision was taken to just make a clean break, make it clear to everybody that that requirement wasn't in place, but we still encourage people to publish their information if they could. And in fact, I understand that around 71.5% of public sector bodies have published their gender pay gap information regardless, and about 45.8% of private and voluntary sector organisations. So I think that's really encouraging, and we will have some data, and it may well be that others will publish later when things become a little bit more normal, hopefully.
Okay, but wouldn't that pay gap data have helped to analyse the impact of COVID and the existing inequalities, both in design of the gender risk to the economic crisis? Would that not have been beneficial in the longer term to have that data?
Well, we'll still have the data that is collected through normal employment statistics in terms of a kind of global and sectoral basis. What we won't have is the individual organisation level data. So, I mean, obviously that is something that would be desirable, but I don't think it's necessarily fatal in terms of progressing work to close the gender pay gap.
Okay, thank you, Melanie. I'll hand back to the chair.
Thank you. And I'm now going to bring in Peter Gibson, please.
Thank you, Chair. We know that the majority of victims of domestic violence are women. We have seen reports of increases of that during the current period of lockdown. What evidence, if any, is there available to you of women with other protected characteristics being increasingly or suffering to a greater extent as a result of COVID-19?
Melanie, can I ask you to lead on that, please?
Yes, certainly. So we have had some evidence from stakeholders of the kind of issues that you're talking about. So, I mean, older survivors of domestic abuse are generally very unlikely to access any form of support. They're less likely to do so than other groups. But we have heard from Victim Support and Hourglass reports of 37% increase in reports of domestic abuse against people aged 65 and over during this period, and also calls from elderly victims having risen by 30%. So there clearly is an issue there. We've also heard concerns from LGBT organisations that there are concerns about the safety of LGBT individuals at home during the lockdown, particularly because of specific issues around threats of outing to other people being used as a form of coercive control. And and there are kind of long-standing concerns about access to support for women from ethnic minority communities. So there had already been funding cuts which had particularly impacted on BME-led support services, and we're particularly concerned about the position of migrant women who may have insecure immigration status and may therefore be face particular barriers in reaching out and accessing support.
Thank you. Just looking at those other characteristics, the LGBT community, and thank you for highlighting the prevalence of that we've seen during the lockdown, domestic violence amongst that community, but also the older generation, Black and ethnic minority community. Have you got access to enough information to be able to be sufficiently informed on that? And if not, what other avenues could you go down to achieve sufficient data in respect of that?
So I think the main source of our information, I should also have mentioned disabled women, where actually accessible refuge space is very difficult to find. I think that the main source of our information, other than kind of crime statistics, is from the sector itself. So we have good relationships with End Violence Against Women, Safe Lives, Women's Aid, and so we are in contact with them and drawing on the they're better placed to report on what's happening on the ground and the kinds of challenges that they're facing during this period.
Do you think that the government is doing enough to provide resources to the needs of some of our protected characteristic communities? I'm thinking particularly about disabled women, LGBT community in respect of refuge accommodation, specific services in respect of domestic violence.
So, I mean, we really welcome the fact that the domestic abuse bill is proceeding, and we have some suggestions about improvements that could be made in that, which we'll be pushing forward. We also really warmly welcome the government's information campaign about domestic abuse, which I think is really important at this time, and the reporting opportunities that have been opened up in pharmacies, that type of thing, is really helpful. We also welcome the provision of funding support for the third sector. I think the concern is that the nature of the scheme means that those smaller, really grassroots, frontline facing organisations may find it difficult to access that support. So we feel that it's really important for the funding to be accessible to those frontline organisations that really need it.
So noting your welcoming of those various support packages that have been coming from government, have you fed back to government your concern about how that support could be more appropriately targeted to reach those harder to reach groups, disabled women, LGBT community, etc., and what sort of format has that taken?
So we have constant dialogue with the Home Office around the bill and around these issues. So there are relationships that we have with officials through which we raise these concerns. Obviously, we've raised them in our evidence to this committee, and we'll continue to make recommendations. We also, in our submission to the Home Affairs Select Committee, made a number of recommendations in this space, which were supported by that committee. Thank you.
Moving away from domestic violence and to issues of policing, at the time of the passage of the coronavirus bill, the Commission was concerned about the increase to police powers and how those increased powers may disproportionately affect members of society who fall into categories of people with protected characteristics. Have you seen any evidence of that?
So I'll take this question, if I may. You're absolutely correct in relation to our very particular concerns at the time of the passing of the bill. In terms of evidence that we've received, some of our stakeholders have raised their concerns in particular cases with us, the LGBT community and BME communities. What we do know in terms of Home Office information is something that's been widely discussed in the press, which is the 21% increase of reported hate crimes against South and East Asian members of those communities, and the link with, or purported link with China, and that's something that particularly concerns us. So in terms of anecdotal and other information, we do have continuing concerns. We do need to be proportionate, something that we are alive to in feedback that we have received, but it is an area where we continue to be vigilant and look at the information and work closely with police forces where we have those relationships. And in Scotland in particular, we do have a close relationship with Scottish Police.
So you highlight to me the issue of increase of hate crime towards the Asian community, Southeastern Asian community, during the pandemic. But specifically in respect of my earlier question, the concern that the Commission had about the police's disproportionate use of their increased powers as a result of the coronavirus bill, is it the case that you have seen no evidence of that being visible?
So in terms of individual cases referred to us, I'm not aware of any. I know that in the early days, there was some considerable attention given to disproportionate application more generally in relation to police powers. But unless Melanie can come in relation to anything that's been referred to us, I don't think that, other than our anxieties and some of our stakeholder concerns, that there are particular cases where there is an equality or protected characteristic dimension that translates into actual cases.
Okay, thank you, David. No more questions from myself, Chair.
So I'd just add, we've seen the National Police Chiefs Council data, which suggests some small disproportionality in the issuing of fixed penalty notices in relation to ethnicity. But I think again, we go back to transparency, the need for proper oversight of the use of these powers as there is in Scotland, and also in the reporting to Parliament on the use of the emergency measures. It would be really helpful to have that analysis.
Peter's muted. Thank you for that, Peter. Did you want to come back on that?
If I may, in respect of Melanie's point, please.
Of course.
Could you just clarify for me what you mean by further oversight that's available in Scotland, which by virtue, I think you're implying that we don't have that in England and Wales?
That's right. So the Scottish Police have set up an oversight body, which includes a representative of my organisation and the Scottish Human Rights Institution, to oversee and monitor the use of the police emergency powers in Scotland. So we have called for a similar oversight mechanism to be set up in relation to England and Wales.
I see. Thank you for clarifying. No further questions from me, Chair.
Thank you. Can I bring in Nicola Richards now, please?
Thank you, Chair, and thank you, Melanie and David, for joining us today. I'd like to ask a few questions about education. And first of all, it's been reported that low numbers of vulnerable children have been attending school Do vulnerable children currently have enough funding and support from the government to study at home, do you think?
So I'll answer the questions on education, if I may. In relation to our recommendations and many of the statements that the Commission and me personally have made, we do have concerns about how the closure of schools does actually disproportionately impact upon particular communities, young working class boys, young working class children, children with special educational needs and disabilities, and disabled children more generally. And some of the statistics, which I'm sure you're aware of, do seem to be pretty alarming in relation to the need for some of those children to receive free school meals, to be fed. And we do have real concerns about the ability of those children to keep up with their schooling, not to have access to technology, and generally to be falling behind. So, those are real equality concerns that we've been very vocal about. We do understand the complexity of the situation. We're not suggesting that this is an easy one for either the government, for school teachers, or indeed unions to resolve. But yet again, and it's hopefully a theme that's coming across to you, that actually as part of the discussion and consideration of these complicated issues, we are very keen, and it's our job, and that's why this afternoon session is really helpful, to ensure that equality considerations and human rights considerations are actually factored into the discussion, because these are children who do need support, where education is transformational, and they can quite easily fall behind. And it's something that, as part of the very difficult balancing act about when children return to school, does desperately need to be factored in. And a point made by the Children's Commissioner very powerfully last week.
Thank you. So currently the government's providing support to vulnerable Year 10 students in the form of laptops and internet access. Do you think that will reduce the risk of the widening existing inequalities amongst pupils?
Well, it's obviously a step in the right direction, and for those in that Year 10 group, it's obviously hugely important, and I understand why they are a priority group in relation to their position in the education cycle. But nevertheless, there are other children whose lives are entirely dependent upon attending school for education, for food, and for care provision. And we would, it's a point I just made really, like that provision to be extended more widely. I'm keen this afternoon that we don't sound naive in relation to the fact that there are affordability issues in relation to all of these things. And clearly, at a time of crisis, there are some difficult decisions to be made. But we need to protect our future citizens, and education is a fundamental right, which it is our duty to remind government and local authorities about.
Thank you. And with the cancellation of GCSE and A-level examinations this year, teachers will be predicting grades for their students. And I know you've touched on this already, but can you set out the risk to students facing discrimination and how you think this can be managed?
Yes, so I referred to the meeting I had with Ofqual yesterday. I think the good news is that having brought attention to the issue, they're now very mindful of equality considerations, the public sector equality duties, as I mentioned earlier on, which are incumbent upon them. From that call, it's pretty clear that it's a very complex issue, and whichever way they go, it's going to result in some difficulty and potential equality considerations which might have a negative impact. So I'm not suggesting that this is easy. Where we ended up was that they will take those issues into account in their deliberations. But actually, it's really important not to underestimate the unconscious bias, if I can call it that sometimes exists in relation to particular communities and how they do in school prior to exams. Often we know that they do better in exams than they do during term time. So the potential discriminatory factors there. To address some of those concerns, we talked about training for those teachers who wanted it as part of the assessment exercise. We also talked about the right of an appeal and an overall evaluation of the process. So we were very sympathetically received in relation to the points that we were making, and we're going to continue to work with Ofqual in relation to the very issues that I've just flagged.
Great, that sounds good. You also touched on free school meals. Do you think the government has successfully supported children enough throughout the pandemic with these?
Well, we know that about 31% of children who are eligible aren't actually receiving school, they're missing out on school meals and they are getting vouchers. We have asked for cash payments to be made. And clearly it's a difficult issue, but actually we need our young people to eat.
Thank you. And then moving on to the recovery strategy, do you think the government's strategy has any implications on the equality for students?
Well, I think this comes back to, again, many of the issues that we've touched on, which is Melanie's talked about, how we are concerned when the COVID Act is reviewed regularly every couple of months, that equality considerations are taken into account. And our overall concern as Commission is that however difficult crisis management is, when we build back, we need to build back better, and actually equality considerations need to be centre stage. I was at a meeting this morning where technology change was being discussed, and apparently there's been more technology change in the last 2 months than in the last 10 years. And it occurred to me, if technology change, which we all now depend upon, can happen that quickly, why can't we accelerate discussions about equality considerations? Because I think we all know that the pandemic has unearthed real inequalities that exist. And to quote Rishi Sunak, our Chancellor, he was talking very powerfully on the economic response to the pandemic by saying we all depend upon each other. And I've been using that statement a lot because I think A, it's true, but B, it couldn't be more true in relation to how we respond from an equality and human point of view to the pandemic and how we build for the future. So my plea is we do need to take these equality considerations into account, and they should be centre stage rather than optional in relation to how we actually move out of lockdown, how we ease the situation, and we provide for everybody as we deal with the longer term consequences of the virus.
Thank you. It looks unlikely that Wales, Scotland and Northern Ireland will align with England's plans to reopen schools. So what impact is this likely to have on educational parity across the 4 nations?
Well, obviously, with the devolved jurisdictions, the different timing is a matter for them. Our desire is to ensure that children can get back to school safely as quickly as possible. And if the timing is not aligned, which it doesn't appear that it will be, that the lessons learned from the early return to work in whichever jurisdiction it is, possibly England, are shared more widely, and that as coherent an approach to returning to school is adopted across the whole of the UK as possible.
Okay, thank you, Chair. That's all.
Could I bring Kim Johnson back in, please?
Thank you, Chair. David, 9 out of 30 kids live in poverty in this country, and you've just mentioned some groups that are disproportionately affected, but you didn't mention how Black kids are disproportionately affected. and also the point about having access to laptops and Wi-Fi. Do you know how many have been distributed to disadvantaged children across the country?
Well, forgive me for not name-checking BME school children in particular, but I certainly did intend, for them to be included in the groups that I was talking about. In terms of the actual numbers, I don't know, but I do know that Year 10 have been prioritised, and I also know that there are large numbers of children who still go without access to online teaching.
Thank you, David.
And can I bring Belle in, please?
Thank you. That follows on quite well, because what I've got is that it's 7% of households don't have access to internet, and actually all of the work is being provided online for kids at home. Now, I know that the Welsh Labour government has put down a £3 million scheme, which is providing laptops and 4G mobile Wi-Fi to any school pupils that don't have it. So it can be done, but I was wondering what impact do you think this was going to have overall in terms of equality in education, and what actions the EHRC might be able to take?
Well, I think the initiative in Wales sounds very positive, and it does go to my earlier point about the importance of access to technology to allow everybody to have online teaching. I think it's fundamental that provision of laptops happens as quickly as possible until there's a return to school. But I do accept that there is an affordability issue. But as I think I said earlier on, these are our future talent. If we're going to ensure that we're an equal society and the next generation has the same opportunities that we seek to deliver under the Equality Act, then this is absolutely fundamental.
Thank you. Can I bring Kate in now, please?
Hello, hello, David and Melanie. I want to ask you about access to food. So can I ask you, what have been the experiences that you know of vulnerable people and people with protected characteristics when it comes to accessing food?
Melanie's going to answer that question, please.
Thank you, David. So we have heard of concerns from disabled and older people's organisations about difficulties that individuals have faced in accessing food. I think it's really important to set this against the sort of general context of the strong support that has been developed by the government and the sector, the food retail sector, to supporting the shielded group, and we think that that response was rapid and generally effective. The concerns that have really been raised with us have been about people who fall outside that clinically extremely vulnerable group, but nonetheless face particular barriers in being able to shop or access food. So the sorts of barriers that we're aware of are inaccessible websites, inability to secure delivery slots, inability to stand in long queues without anywhere to sit, some restrictions on shopping being applied in ways which prevent carers accompanying, for example, partially sighted or sight impaired shoppers. So, some incidents where things have not been working as well as perhaps they might. And so those are the issues that we've been concerned about.
And certainly early on in the pandemic, I had a lot of correspondence from constituents who struggled to get an online supermarket delivery slot. Have supermarkets taken the necessary steps to protect vulnerable people when they are shopping?
So I think, I mean, obviously the supermarket sector had to pivot quite quickly to respond to the crisis. And I think, you know, some of the initial issues have eased slightly in that they've managed to create additional delivery slots, etc. The problems that are for people who've got, for example, access barriers, who may not have access to the internet, who may want to place a telephone order and that facility might not be available. So I think what we have sought to do is remind the sector that the duty under the Equality Act to make reasonable adjustments for disabled customers still applies during this period, and we, you know, seek to work constructively with them to see how things could work better for people across the board. I think there are really good examples. You know, I personally have experienced very good examples of staff in store responding really sensitively and positively where people have faced particular barriers. But I mean, as with any large sector, that's not uniformly the case across the board, as has been highlighted from the sorts of issues that we've seen.
Apologies, my internet completely dropped out there. I continued with the sound, but in the main. But apologies if I ask you anything now in the period that you did drop out. Can I ask, what has the outcome of your correspondence experiences of disabled people shopping?
So we wrote to the British Retail Consortium just highlighting the concerns that had been drawn to our attention. They wrote back, and we were just concerned that that point about the kind of ongoing duty to make reasonable adjustments hadn't been fully responded to. So we wrote again. We also wrote to the department, DEFRA, just to draw the minister's attention to that correspondence. And as I mentioned earlier, as a result of that, I met with the minister last week and continue to have dialogue with officials there, which I think is constructive in terms of seeking to address the kinds of issues that we and disability organisations have been raising.
Thank you. And we know the food parcels from the government to those who are shielding, in my experience, have often contained very little and have often also arrived weeks into the crisis. How effective have the food packages been to the most vulnerable?
I think, I mean, I don't have a massive amount of detail about the operation of the system. I mean, obviously it's great to have that system. We haven't been particularly alerted to problems about the operation of the system, except that I think it would be welcomed if it could be broadened out beyond that clinically extremely vulnerable group, which might go some way to addressing some of the concerns that have been raised by that broader group.
Okay, thank you. And with 1 in 3 children and cash payments, but with 1 in 3 children in poverty and most households in financial hardship due to the coronavirus pandemic, what more should the government be doing to ensure food security?
So I think, I mean, David's already talked a little bit about the free school meal vouchers for children. There were some initial problems with that system, I think, in terms of the vouchers getting to people. In Wales, they have changed to a system of providing a cash alternative, which we think is very positive, and it would be helpful if that could be considered more broadly in other parts of Britain. But I think it probably comes back to the broader kind of questions that David was talking about earlier about, the financial pressures that families are facing. As we know, the furlough scheme affecting people losing their jobs, the increase in the number of people claiming universal credit, and the delays in receiving universal credit. And I think it's just really important. I think in one of your earlier sessions on this inquiry, Professor Marmer really highlighted the relationship between welfare support and public health. And I think that, that is clearly kind of playing out in this pandemic and may be one of the contributory factors in relation to the kind of disproportionality in the BAME community's experience of the virus. So all of these things, come together. And I think this, the experience that we're going through is a massive challenge, but it's an opportunity for us to think about some of these issues that we've been concerned about for so long, and what it means for what kind of country we want to be when we come out the other side of this.
And finally, if I can just take you back to your conversations that you've had with DEFRA, what exactly has been said around food insecurity and access to food for disabled and older people? Can you tell us more about what conversations you've had with them?
I don't think I can really talk about the detail of the conversation, but I think it was a constructive conversation looking at how the concerns that have been raised by disabled people's organisations and older people's organisations could be responded to positively, given the all the other constraints that everyone is operating within.
Okay, thank you, Chair.
Thank you very much, Kate. Can I now bring in Sarah Brickcliffe, please?
Thank you, Chair. Hi, Melanie and David. I'd just like to ask a bit about housing and how the pandemic had an impact on people with insecure housing.
Thank you. And Melanie's going to answer the housing questions, if you're okay with that, Melanie.
Yeah, that's fine. Thank you, David. So housing is, just to say up front, housing is not one of the kind of major issues that we have been prioritising work on in the current period. But we are obviously, we have worked on particularly housing issues and accessible housing for disabled people in the past. And have concerns about insecure housing, overcrowding, and homelessness. So we welcome the suspension of repossession activities, but obviously the impact of changes to employment, furloughing, and the impact on income of that, and redundancies. And the prospect of sort of further recession in the future is of massive concern in terms of people's housing security and ability to pay their rent or mortgage and keep a roof over their family's head. We also really welcome the steps that have been taken by government to get homeless street sleepers off the streets, and that's really great. But I think the concern is, what's going to happen when the repossession suspension is lifted, when homeless people are no longer able to be accommodated in the sort of hotel accommodation where they've been able to stay, and the impact of the economic hit that many families have taken really comes to fruition. Whether this could lead to, a further housing crisis. And of course, all of these issues interlink with socioeconomic inequality and a number of protected characteristics, particularly single parents, people with mental health conditions, Black and minority ethnic communities, and disabled people. So I think it's an area where there are kind of emerging concerns.
With the concerns going forward, what further steps do you think that the government could take to support people to return the housing?
Well, I think the financial support that the government has provided to keep people in work is really helpful, and it's good to see that that is being extended and that part-time furloughing is going to be available. We'd like to see that happening sooner. I mean, we haven't developed any specific recommendations in this place, but I think it's just an area that we would flag as one to be really, really aware of, and that government, again, should think about human rights obligations and the public sector equality duty in thinking about how we come out of the situation that we're in now and anticipate some of the impacts that could occur in the future and develop steps to mitigate those where possible.
And I know you've said that you haven't really looked at it in depth during COVID-19, but do you know whether the government provided sufficient guidance on how to protect vulnerable people who lived in overcrowded housing?
I don't specifically. I mean, I think it's again, it's one of those areas where people's ability to comply with kind of social distancing is particularly difficult for people who live in overcrowded accommodation or accommodation where there's no access to outside space. And those may well be factors that are playing into how the virus is spreading more in particular communities. So these are all issues that I hope the Public Health England inquiry will shed some light on, and other research that's being done.
And has the Everyone In campaign been successful?
So we think it has, that it's to be welcome, but I think the question is what happens when that comes to an end. Yeah.
Sorry, and has the government provided sufficient guidance for hostels and day centres? Is that something that you know?
It's not something that we've particularly looked at, I'm afraid.
Okay, and on your assessment then, has the data reported of the number of homeless people being given accommodation been accurate?
I have no reason to think that it's not accurate, but again, it's not something that we've specifically been focusing work on.
Okay, thank you. And just about, I'd like to know what the impact has been on Gypsy, Roma and traveller communities, and how the government can address the impact for those communities.
So there, I think, this goes sort of beyond the kind of housing issues and goes into kind of the health impacts, impacts in education, and access to the employment support schemes. So, we know that Gypsy, Roma, traveller communities are multiply disadvantaged and face multiple barriers, pleased to see that the Public Health England work will be looking at that as a particularly vulnerable group. But I think it, particularly in relation to what David was saying about education, there are we know that Gypsy Roma traveller children face particularly big attainment gaps. There are concerns that those children and others who are already facing barriers in education, like children with special educational needs, that this period will just lead to those gaps widening. And so I think it's really important that as we come out of this period, there is special attention paid to providing the support needed to bring those, to reduce those gaps and bring those children back on track.
Thank you, Melanie. I don't have any more questions, Chair.
Thank you, Sarah. Can I follow up, Melanie, on the issue of the Everyone In campaign and those who perhaps might remain excluded from that? And whilst I know that many local authorities have worked incredibly hard to bring as many people into emergency and temporary accommodation as possible, certainly anecdotally, it is the case that those with mental health conditions, and we know that street homeless people often have multiple vulnerabilities, but those particularly with mental health conditions have found it harder to access hotel accommodation. Do you have any evidence around numbers of that and whether those with mental health conditions are receiving the parity that they should do?
I don't have any information about that, I'm afraid.
Okay, thank you. Can I bring in Kim Johnson, please?
Thank you, Chair. Melanie, just wanted to ask a very quick question about care leavers and looked after children and issues about homelessness and whether that type of data is collected currently. Thank you.
I think it is collected, but it's not data that I have to hand.
Okay.
So I would imagine that that there is that data available, but I can look into that for you and come back to you.
Yeah, because I see that as an equally vulnerable group at the moment as well, given that a lot of care leavers and looked after children end up living rough on the street and subject to mental health issues. So it would be useful to have a sight of some of that information. So thanks, Melanie.
Chair, could I just make a particular point about the breadth of our work, and Melanie referred to it. We've obviously had to try and prioritise our particular responses, not just during COVID, but more generally, because clearly there's a lot that we could do, and our board, having liaised with our stakeholders, have worked out a clear set of priorities, which is part of our business plan. We've adapted that really quite quickly to respond to COVID. And I was really keen just to reinforce that on the homelessness point and housing more generally, it's not because we consider the issues to be unimportant or insignificant. It's just that due to our resources and the fact that we as an organisation is similarly challenged by working remotely during COVID, we've alighted on priorities which really focus on much, but not everything that we've talked about today.
Thanks for clarifying, David.
Thank you for that, David. Can I just ask a final question? And if any members wish to come in again before we conclude, could you indicate very quickly? Is that at various points during your evidence, we have heard the phrase seeking to engage. I think particularly Melanie said it in relation to the race disparity unit, but there has been much reference of trying to engage with secretaries of state, with ministers at all levels, that you've had engagement from officials, but it's been hard to break through with ministers. Do you think that the Commission could be doing more to make sure that your voice is heard? And what could we do as a committee to help you make that breakthrough with ministers where you perhaps aren't getting responses or feel that you might be being ignored?
Well, thank you for asking the question, Chair, because I was alive to the fact that you started off with that tenor of questioning, and I'd similarly been listening with that in mind. I think as an organisation, we've been very agile and very assertive, and actually been very clear with a large number of government departments and with officials. We have tried to reach out to the Prime Minister and to ministers, and whilst we are in close contact with Number 10, we're not getting the traction that we would like, because I think two things. One, we want equality and human rights issues to be embedded in everything that the government is doing. I think there's a lot of very goodwill to ensure that that happens, but in practice, I think other priorities sometimes overtake it, and it's seen as an optional extra. And secondly, there's a question of affordability. But I'm keen to stress that we would like your help. I mean, there are affordability issues that some people take into account to say that this is an optional set of objectives, which we don't agree with clearly. But if you, in answer to your question, we would like to engage at the highest possible levels. We would like your support to enable those meetings to happen. I think they're not happening not because we're not demanding them or being assertive enough. It's just that we're not seen currently as being a top table issue.
I think I might have to take issue with anybody considering equality not to be a top table issue. Clearly, you're right when you say it should be embedded across government in everything that they do. As there haven't been any members indicate that they wish to ask any additional questions, that concludes the Women and Equalities Committee evidence session on COVID-19 and the impact on people with protected characteristics. Can I thank both our witnesses for contributing today? It's been much appreciated. Order, order.
Can't you see it too? There's an elephant in the room.